everybody out there. Welcome to our Raising Elevated Families. We are here with Dr. Kiera Smialek, a pediatric naturopath or a naturopathic pediatrician, however you want to say it. But sorry for the delay. We had a little technical difficulty on my end here. It wasn't Dr. Smialek's any contribution from that end. But thanks for coming on here, Doc, and talking with people that are out there in our sphere, our community, but even out there on Facebook and whoever sees this to help them understand a little bit more about you and your practice and what you do. So I guess to start off, I think one of those foremost questions I always like to know about anyone that I meet is, how did you become what you are? What drove you to become a naturopathic pediatrician? Especially, how it's sometimes people are like, what is I never even heard of a naturopathic doctor or even a pediatrician at that. So starting off, tell us a little about yourself and how you got to where you're at.
Sure. Well, thanks for having me, Dr. T. This is really fun to do and to just explain kind of what I do, because yes, it is a common question. So I initially did my training at naturopathic medical school. So basically that would look like doing more focused natural medicine training, but also doing the conventional medicine training on top of that. So initially when I was in college, I actually went down the route of conventional medical school, decided I was going to, become a physician. But I was a little disheartened with the regular medical community. I felt like there was times where I was getting sick frequently and we couldn't figure out what exactly was going on. And I felt like I was just given a prescription each time. And so to me, that just felt like there's a better way. That doesn't make sense. Why are we not figuring out what's actually wrong with me, as opposed to, just treating and band-aiding the symptom? So someone had mentioned naturopathic medicine to me, and just the general philosophy of the medicine, where you focus on holistic health and you treat the whole person and you address the cause of an illness, you empower your patients. That seemed more like healthcare to me. And so that's kind of what led me to naturopathic medical school. The pediatric part came a little bit later. I would say I've always had an affinity for children. I'm the oldest of 4 kids, and I helped raise my younger 2 siblings. So I've always had that nurturing aspect. But really, when I learned more about naturopathic medicine and saw in school how much it actually helps children, because there's such a big focus on prevention, that really is what kind of sealed it for me. And that I really am passionate about children's health and children's health care and the future of our children. And this seemed like this is a way that I can really make a difference, is, seeing these babies from birth and doing so much of that prevention so that we're creating healthier lives and decreasing their risk of illness and disease as they get older.
And that's why we resonate so well, because that's even with chiropractic, and especially when people hear about a pediatric chiropractor, that even of itself kind of blows people's minds as well. That we take care of babies and kids, whether they're colic or reflux or ear infections, like sensory challenge kiddos. It's one of those things that people aren't accustomed to hearing, and learning more about it is, obviously a way for them to have another option, which and correct me if I'm wrong, it's most people are looking for what you provide, what I provide, and the things that we do, with more focus on the mental health, and then what you focus on is, everything else, and help and support it. And that's why I love having you as a resource for not only myself and my family, because we use Dr. Smialek for our kiddos, but for our practice members and those that we come across, to be comfortable with directing them your way, because I find that most parents want that. Many times we're just so indoctrinated that we go to the doctor, like, can you just do this and that and just follow along? But when there's another option, people kind of just, all right, think about it and explore it, and they're able to come and interview you, right? Like, they understand with what you do on a one-to-one level too, which is so important with our kiddos as well. But what do you find that most people that you come across in your experience, how and why do they seek you out oftentimes?
Sure. So a lot of people are just looking for other options. So I have a variety of different patients in my practice. So I have just the wellness care patients where I'm seeing kiddos from newborns all the way through teenagers. And then I have a host of patients who come and see me for more chronic issues where maybe they've dealt with a number of different specialists, they've worked with their other pediatrician, and they're just not receiving the help that they want to. So in terms of that aspect, a lot of people with the more chronic issues are, coming to me because their child's asthma is just not getting better on the medications, and the doctors want to continue to keep adding medications, but the parents are concerned about continuing to add more and more steroids. And they want to address, why is this happening? Let's figure out why, as opposed to giving them more medication. So that's a really common reason. Or medications are just not working, or they really want to avoid having to do the medications due to sometimes medication side effects. So that's a big thing with a lot of the ADHD medications, and why I see a lot of ADHD kiddos is because parents are trying to avoid having to do that. Because they are concerned about the potential side effects of those medications. So, and naturopathic medicine is a great option to kind of help some of those kiddos. From the wellness perspective, a lot of parents are just looking for someone that they can create a really good relationship with. So when they have babies, you're going to see your doctor on a pretty frequent basis, and you want to feel comfortable with that doctor. You want to be able to ask them any question that you may have. You want to be able to create a really good relationship and feel empowered to make really good healthcare decisions for your child. And so a lot of people just feel they don't get that. They don't have that time with their conventional pediatrician. I tend to spend a lot more time with my patients. And then the prevention piece is really key. So in conventional medicine, they're so focused mostly on, treating the symptom and addressing it as they get sick. But as opposed to naturopathically, we're looking at, how do we prevent that? How do we prevent that from childhood? And a lot of parents are looking for that aspect of it too. So that is a really key part to why they would seek out my care.
Absolutely. And I love that too, because that's where the classic pediatrician is, and they're trained, their toolbox is to treat the symptom, right? Mm-hmm. Not to ask the question of why. It's just more treat the symptom and what can we do to help control that symptom, and not so much to really focus in on getting to the center and the cause of it in the first place. And that's why I love being exposed to the naturopaths, and especially with our kiddos too, being able to help that and boost their body's health potential, right? What can we do to prevent the best prevention is to boost health within us, right? Mm-hmm. And that's support those things that our body is born to be able to do, and do more of it, sure. Instead of wait until something happens, right?
Exactly.
I love about what you do too. Now you don't only do your practice, and your practice is located over at Modern Milk. If nobody knows where that is, it's over on Thunderbird and Scottsdale Road, or just north of Thunderbird on Scottsdale Road, which I don't know anybody who doesn't know about Modern Milk anymore now. It's a great resource for parents and moms to be, and the whole genre there. But you also do some educating over there. Is that correct?
That is correct. So I actually am part of one of the expert speakers at the Happy Mom School. So Modern Milk has created Happy Mom School, which is a 8-week course for new moms, where they group your babies around the same age. So usually you start when baby's somewhere between 4 to 6 weeks of age, and each week you meet for an hour and a half to 2 hours with a group of other moms who also have babies around the same age, and you have a different expert speaker coming in each time. And so that has been a great resource for so many moms, and moms have created lasting relationships. And it's really fun for me to go and talk to these moms because I talk about some of that prevention stuff, some of the things they can do just starting in infancy for their babies to really make sure that they have a really healthy gut, and we're decreasing illness and disease as they get older. So that's always really fun to do. I also they started a new group here called Happy Bump Group. So this is for expecting parents, which is usually in the evenings. So we're about to start that program where there'll be different experts each time, and you can come. So the one that I'm featured in is what to ask a pediatrician. So when you're interviewing a pediatrician, questions to ask. So you'll have different things in the preparation for having your baby. So that's another exciting class that's coming up here at Modern Milk.
That's awesome. I know the resources that you guys are providing over there. I know even in May for Mother's Month, right? There's another workshop that's going on, and because I'll be doing a talk there. We title it "What the Flux." All things around reflux and colic and that aspect too. So I love that resource for those of you out there looking for a community. In addition to what you may have, it's a great community, especially for those new and expectant moms, for those moms, and I like to, what you. It's the stages of where you are in motherhood, right? It doesn't matter how old you are, but it's where your kiddos are at, because you go through the common things, and it's so important to have that community, because it takes the community, it takes a village, right, to raise a family. And what I find too is there's a lot of parents that are out here, and especially Arizona, that have that family structure where their parents are around, and so it helps give this additional community. I mean, even they may be the first ones in their friend group, right? So they can't rely on their friends because they don't have the experience to be able to bounce things off of too. So it's really nice to be able to have you over there for everybody as well. So how does somebody get in touch with you if they want to connect with you?
Sure. So the best way is through my website. So my website is naturalkiddoc.com. So pretty straightforward on there. My phone number's on there. You can call my office, or you can fill out a form if you have questions, and I'm happy to answer questions as well.
So awesome. Well, thank you, Dr. Smialek, for coming on here. We like and sweep, but full of value, action-packed to empower those moms and parents that are out there. But thanks again. If anybody does have any questions, leave comments below. Contact either Dr. Smialek, contact myself. We'll be able to help answer those questions you look for, direct you in the right way that you're looking to get any answers that we may not have as well. But thanks again for coming on, Doc.
Sure.
And look forward to obviously seeing you here shortly as well.
Sounds good.
Right.
Thank you so much.
Absolutely. And everybody, until next time, be elevated.